Hello everyone and welcome to the continuation of the free training preparing you with the background knowledge for the interview questions that you might encounter during your job interview for the position of a healthcare assistant in the UK. We've done some topics in the past on this particular training. We're going to be talking about 6 different topics. This is mental capacity, first aid, information governance, medicine administration, dementia, health safety, and welfare. That's about 6 topics. So we're going to be giving you introduction to all these 6 topics. We encourage you to do some personal learning, do some personal research on these topics so you can have more knowledge. This training is an introduction to some of these topics, and it will be helping you to have an idea, the background knowledge you might need if you are confronted with questions about relating to these topics during your interview for the position of a healthcare assistant in the UK. Okay, so in the past we've done some topics that are also for healthcare assistant jobs. Okay, because when you are attending your interview for the position of a healthcare assistant, you never can tell where the interviewer will be asking you questions from, just to check if you have any background knowledge of the position you are applying for, and that is the position of a healthcare assistant. So as a healthcare assistant, you are expected to have some background knowledge of mental capacity, how to how to deal with patients who lack mental capacity. We're going to be talking more in details about that. Then how to abide by the rules of first aid application, in case of emergency while you are taking care of your patient. Then the third one is information governance. That's about maintaining the privacy of your patients, and medicine administration. That's the fourth one. Then dementia. You might also be dealing with patients who have dementia, so you need to have some knowledge of what dementia is, what it means, and how to take care, some basic knowledge of what to do when you are taking care of someone with dementia. All right, it's a mental health challenge, and you might have such patients in your care when you work as a healthcare assistant. The sixth one is health safety and welfare. Your own personal safety and that of your patient is very important when you are taking care of them. So all these 6 topics are very important for you to have, no matter how small, the background knowledge when you are working as a healthcare assistant. So I will encourage you that after you've listened to this video, you take time out to do some personal study. Check out some resources on the internet on mental capacity as a healthcare assistant, first aid as a healthcare assistant, information governance in the healthcare setting, medicine administration, as a healthcare assistant. Although as a healthcare assistant, you are limited to the type of drugs you can give to your patient. We'll talk about that. Then talk about dementia. You can also check the internet to have an idea of what dementia really means, and health safety, and welfare in the healthcare setting. Okay, so because these are just introduction, you might need to do some more study on your own so that you can have a good understanding. All right, I will be giving you some scenario-based questions that are possible, some questions that have been asked in some interviews in the past, so that you will see how these questions can come from the interviewer as regards all these topics. Okay, the first topic we're talking about out of these 6 is mental capacity. So what is mental capacity? For those of you that like definition, mental capacity is having the ability to make decisions for yourself, okay, and communicate them to others. So in this context now, your patients how can you tell whether they have mental capacity? Some the fact that they are on the sick bed doesn't mean they don't have the capacity to make decision and to communicate them to you. You know, they are only uh, maybe ill or they are elderly. You know, that doesn't mean they lack mental capacity. Okay, so at certain times there may be they come to a point where a person's mental condition impairs their ability to make decision and to be aware of and understand things. Okay, so in that situation, then you can say they lack mental capacity. But once they are able to make decisions for themselves and communicate them to you, then you know they have mental. So you can't just assume that someone lacks mental capacity by assuming, okay? Because according to the law, you are not expected to assume that someone lacks capacity by just assumption, okay? According to the law, a person is trying to lack mental capacity if they're unable to undertake some things, like some basic things, like if they are unable to understand the information given to them, if they're unable to retain the information long enough to be able to make a decision, uh, if they're also unable to weigh up the information available to make a decision, if they're also unable to communicate the decision by any means possible, you know, for example, talking, sign language, or even through muscle movements, such as blinking of eye, nodding, shaking of the head, you know, these are possible ways to tell. But you can't assume that someone lacks capacity on your own, okay? There are some basic rules that guides assessment to tell if someone lacks mental capacity, all right? Because mental capacity can be due to illness, injury, or a learning disability or mental health problems that may affect how their brain works, okay? So we're going to be talking in detail about the basic steps, you know, on how these things are determined. All right. So at the end of this training, you'll be able to explain how to assess, you know, what the Mental Capacity Act 2005 is all about, you know, what it means, what an independent mental capacity advocate does, you know, what it means by consent, you know, in terms of mental capacity. Those are all the things you need to know, some basic things that are important. Then you can do some personal reading on your own when it comes to mental capacity. Okay, now we've said earlier that mental capacity is the ability to make your own decision and be able to communicate them to others. You know, there may be occasions where an individual may not be able to make their own decision because of an illness or mental health problems. Okay, they may be living with dementia. You know, they may have some learning disability. You know, that could mean that they may not be able to make some fully informed decision on the basis of their capacity because they are not 100% fit. Okay, they have some health challenges that's making them not to be 100% fit to capacity. So they lack the capacity to make some of these decisions by themselves. You know, they can't even, you know, comprehend some of the questions you're asking them, not to even talk of taking a decision. All right. If this is the case, they may be not be able to, they may not be able to do, like, they may not be able to understand information given to them, you know, they may not be able to retain that information. They may not even be able to communicate the information that they want to tell you, you know, even if they try to decide on something. All right. So we know that mental capacity, lacking the capacity, can be permanent or temporary. So all this has to be assessed by the experts. Okay. So and this assessment is done, you know, by experts in the field, you know, by doctors, by psychologists, by nurses, depending on uh, the situation of the person. All right, depending on the person's situation. Okay, so there are different professionals that are involved in the assessment of a person's capacity. So there are some key principles, you know, for professionals. You know, in some cases, it might be up to the carer to decide whether the person needs help in making a decision. But in most cases, you need professionals to assess the person, you know, in order to be sure that you are following the Mental Capacity Act. Yes, there's a legislation that was introduced in 2005 to protect and restore power to all those in the UK that are involved in care or treatment and who are unable to make, all or some decisions by themselves. Okay? Now, the legislation is very important. It's very, very important. You might be asked in your interview that what are the key principles of the Mental Capacity Act 2005? All right? Number one, there are 5 of them. The first one is, it is very important that we never assume, okay, that a person does not have mental capacity. Let me get it clear to you. The first legislation out of the 5 legislation of the Mental Capacity Act 2005 is that you must always assume that a person has mental capacity unless proved otherwise. That's 1. Then 2, individuals being supported to be supported to make their own decisions. Okay? Number 3, someone should not be thought of as incapable of making a decision if their decision seems unwise. This means that an unwise decision made by someone doesn't mean the person lacks mental capacity. It's up to them to make that decision, whether it is wise or unwise. As long as they have the mental capacity, the decision is final for them. Okay? So, number 3, again, someone should not be thought of as incapable of making a decision if their decision seems unwise or stupid. Let me use that word so that you understand what I'm saying. All right? The 4th one is, always put the person's best interest at the center of every decision. Okay? For example, if the person lacks capacity to make decision, the patient's best interest must be the basis of all decisions made. In case of an emergency, for example, someone is dying on a sick bed and he can't talk, he can't move, he lacks capacity at that point, the emergency decision has to be taken on whether to perform a surgery on that person, and there's nobody. Now, in that situation, the best interest is to save that person's life. So that decision is to be made, is to put the person's best interest, which is to stay alive. So that's number 4. Number 5, always consider if there is a less restrictive outcome when making a decision for someone. Before finalizing a decision, always think again whether there may be another option that would not really restrict that person, that will not limit the person's right to movement or liberty. Always look for the least restrictive option that will not limit the person's liberty. The least restrictive option possible. When I say least restrictive, what it means is that look for the option, when taking the decision to favor someone, look for the option that will not limit the person's freedom. For example, if you want to help someone, look for an option that will still make the person free to move, as much as that is not the only option. Okay? Always look for an option that when you take a decision for someone, make sure that option still makes the person free. Even if it's that person's best option. But make sure that it does not restrict that person. The least restrictive option available. So those are the 5 principles. Always consider, the 5th one, always consider if there is a less restrictive. So use the least restrictive option available, as the best option when trying to take a decision for someone. All right? Now, the independent mental capacity advocate, that is the role of a mental capacity advocate. All right? It's someone that represents the interest, in the decision-making process. All right? They usually represent the individual when the individual has nobody independent, like their family member to help the decision-making, with nurses, doctors, and professionals. All right? So these are things that are to be done by the professional, and you will be made to understand more of these things, in terms of what to do, because you have to also understand the best interest principle. The best interest principle is understanding the specific circumstances and the needs of the person, of the patient. You have to also, the best interest principle also involve the decision that is to be made and the urgency of the decision that is to be made. Okay? So those are the things that would lead to taking a decision quickly, and so that immediately the person gets to be attended to quickly. All right? So those are some of the things. It might be asked during an interview that your patient lacks mental capacity, for example, and what do you do if that patient is at the risk of, maybe, okay, for example, now you are with a patient that lacks mental capacity, and you are supposed to take a decision, as to whether you are to. Okay, let me give you an example now. Your interviewer asked you, you're supposed to take your patient out on a walk, okay? And while you are preparing to take him for a walk, he decides not to wear shoes. He said he doesn't want to wear shoes, but he wants to go for a walk. And you know that walk is a long distance, all right? And apart from the fact that he doesn't want to wear shoes, he's telling you he doesn't want to wear jackets. The weather is cold. And you know that it's in his best interest if he wears the jacket. Okay? Now, you assess the person you are dealing with. You are the carer. Now, you tell, if the interviewer asks you, what do you do in that situation? Now, you tell your patient that the weather is cold, you need to put on your shoes, and you might also need a winter jacket, okay? So that you don't get cold, you risk exposing yourself to cold, So if he insists he wants to go, you assess his capacity, What you do is that you take the jacket with. If he still insists he wants to go barefooted and he doesn't want to wear a jacket, those are unwise decisions. But you assess him based on his mental capacity, because if you were not there and he still wants to go out like that, that's his decision. All right? So after assessing him and seeing that, okay, those are his decisions at that point, and he still wants to go out, what I think you can do, and what your response should be to your interviewer, is that you're going to carry the jacket with you, carry his shoes with you, okay, and go with him. Because you have assessed him and you have found out that he has the capacity, to make those decisions by himself. And as long as he's not going to be hurt, assess the situation. It's not going to harm him. He's not at risk, okay? Assess the risk and you look at, okay, it's better you hold the jacket. If it gets cold along the way, then you can hand the jacket over to him, and you go with his shoes too, okay? Because those are his decisions, and even if it is unwise, okay, except if walking barefoot poses health risk to him, then you have to communicate to him about the risk involved, and you assess it whether he's able to understand you. Okay, so you have to assess whether he's able to understand that going out barefooted, that is after assessing if going out barefooted is going to affect his health, if it's going to be at risk to his health, and you also have to assess if he has mental capacity to tell whether it is at risk to him to walk barefooted. Okay, so you can go with the winter jacket and also go with the shoes, so that in the course of of going out, he would realize that it's his decision now whether to go back when it gets cold, and is able to, discern by himself, because he has been deemed to have the mental capacity, to take the decision whether he wants to go out with his winter jacket or barefooted. Okay, so it is his mental capacity at play, because you cannot take a decision. You cannot assume that he lacks mental capacity because you feel that you want to wear shoes, and it is not wise not to wear shoes when you're going out. Okay? But if he feels that is the way he wants to go out that particular day, you have to allow him, based on your own assessment of his mental capacity, that is he able to go? Is he able to communicate to you that he understands, okay, that his feet can be exposed to cold and is also going out into the. So the response to such an interview question is you allow the patient to go, as long as you have assessed that he has the capacity to take these decisions, and he understands the consequences if there are any, and then he understands that this decision he's taking is able to communicate it to you, that he understands the decision he is taking. Okay, so you write it down on your notes that Mr. A or patient A decided to go on this walk without his winter jacket, without his shoes, and you make sure you put it into writing, but you cannot restrict him from going. All right, so you go with him. What you can do is to hold the jacket in your own handbag or the shoes in your own handbag, just for in case maybe he changes his mind, on the journey. All right, but that will be your own choice, okay, whether you want to take it or not. All right, then some people like to walk barefooted. Don't forget, because you are cold doesn't mean others are cold. So if that decision appears unwise to you, it doesn't mean people that take that decision lack mental capacity. Okay, so it is your role as a healthcare assistant to support the decision of your patient that is deemed to have been assessed to have the mental capacity. That is after they have shown that they understand and they're able to communicate to you what they want. Okay? Some people like to walk barefooted, and it's a form of exercise for them. Okay? Some people even see it as a form of healing, natural healing energy. That is another topic for another day. All right. So those are part of the things that you need to understand as a healthcare assistant. Another thing we are talking about is consent. Okay, consent is very important when you are taking care of a patient. To give consent means a person must give permission before they receive or take anything from you, whether treatment, whether a medical examination, whether tests. This is usually done on the basis of explanation. You have to explain to your patient what you want to do and try to get their consent before you do anything, okay, that involves maybe their treatment and all. Even if you want to take care of somebody, you want to bathe them, for example, you want to help them with, you let them know, consent is the principle that an individual must give their permission before they are given any type of assistance or support. Okay, you need to gain consent for seemingly even simple everyday activities, such as you want to help them with, even if you are feeding them, for example, and the crumbs fall on their chin, you have to let them know. Ask them, can I wipe your cheek? Can I wipe this off your neck? You gain consent before you touch them. Gain consent before you do anything. you know but if the only exception is if emergency treatment is needed to save their life and the individual is unconscious and unable to make a decision, then a procedure should go ahead and the decision should be explained to the individual afterwards. All right? Okay. Do not pressure anyone to do stuff for them. Okay? It's very important when you are taking care of your patient that you don't pressure them. Okay? Very, very important that you don't pressure your patient when you are taking care of them. Okay? Now, the next topic we're talking about now is first aid. Okay? First aid. First aid is is the number 2 topic. Okay? First aid. How do you administer first aid? Because in the display of your duty as a healthcare assistant, there might be some accidents, there might be, uh, you know, some situation where you need to take care of injury at work, or so you have to understand some basic principle of first aid. So we'll just be talking about it briefly. This is introduction to first aid at work, okay, as a healthcare assistant. You are going to be introducing you to incidents that can occur in the workplace, so that you'll be able to protect yourself, give yourself priority, those around you, try to keep them safe if you can, and then help anyone who also needs help. It is important that your service provider, your care provider, that's your employer, that they make first aid equipment and facilities available, to you as your employee. All right, so that in the case of emergency, you can receive immediate attention if you are injured at work. Okay, that is one of the health and safety regulation, okay, to work in a healthcare setting. All right, usually when you are working, your employers will have provided emergency first aid, as part of the basic standards when you are working as a healthcare assistant. All right, so you have to know that in some cases, you have to understand some basic principles. When there is maybe you injure yourself, for example, maybe you puncture the needle in your thumb, for example. You have to quickly bleed out that part of where the injury happened. You have to bleed it out. Make sure the blood flow out from that punctured place. Then you flow out, allow it to come out. The blood should come out. Then you wash it out, with water. Then you make sure also that you report to the occupational health. That is important. All right. Then you inform your line manager, immediately, so that you have to report such accidents, okay, when it happens in the work environment. All right, you're going to be trained on some basic first aid exercise, like how to administer those type of training will be done for you after you get the job. All right, those are some of the trainings they'll do for you during your induction, and then on the job training after you get the job. That will be done for you by your employers. They're going to be teaching you some basic CPR, resuscitation, how to administer CPR, cerebropulmonary resuscitation techniques, how to manage chest pain, when your patient is telling you a sudden chest pain, how to tell if it is a suspected heart attack. So those are things they'll be teaching you, during your training when you start your work as a healthcare assistant. Okay, so you don't have to worry about all those ones now. The first aid is basically most of the things you'll be taught when you start your work as a healthcare assistant. All right, so yeah, there are some common incidents that happen in the as a healthcare assistant, that you have to call you have to know the emergency number. You have to call the emergency number when an incident happened that is that requires them to come in. Okay, you call the medical helpline. Yeah. So the third one, which is information governance. All right. Information governance, okay, is basically about information protection, information, maintaining privacy, keeping information, uh, the standard principle and best practice in relation to information that you are exposed to at work. As a healthcare assistant, you are exposed to information about your patients, information about other patients too, and you have to do everything you can to protect information. You have to understand that there are different types and there are different values of information. You have to understand that there is what data security is. You have to ensure the confidentiality and integrity of data of your patients. You have to identify possible data breaches, that you suspect, and incidents that are likely to be of data breach. Any suspicious email that you see, maybe you yourself, you accidentally send for example, you accidentally send a patient's information to the wrong address. That means you have sent a patient's information to someone that should not have access to that information. So under information and information governance, you must report such error, to your line manager immediately. Okay, because they give room for human error, but when it happens, you have to report it immediately, to your line manager and to appropriate data protection regulatory authority. Okay, you also have to understand that it's important to keep good record, all right, so that anything that happens, you are able to recall, because records kept properly makes the job of everyone easy. Proper keeping of record, all right, very, very important. That is what information governance is all about. All right, so you have to also understand the policy of your employers as regards to information governance, because every care provider, that's your employer, they have uh, their own policy when it comes to information governance. So they are going to be disclosing all of that to you when you start working with them. All right, because all data is valuable. Okay, and usually most data are they keep records of people's health and personal details and confidential information, sensitive information, so you have to understand that this, you cannot allow information breach, to go out. All right, so that is very, very important when you are working. Any possible sign of data or information breach, you must report it. It is good practice to safely keep records. Okay, making sure the records are accurate and up to date. Uh, and when you are taking care of a patient, you must also always confirm again from them. If, for example, you are asked to give so patient a particular medication, you have to ask them again, what is your name? What is your date of birth? And confirm with what you have and make sure that it is accurate, so that you don't make the mistake of giving the wrong patient, the wrong medications. Which takes us to the fourth topic, medicines administration. All right, medicines administration. As a healthcare assistant, your basic role is not going to be to administer medicine. All right, but in some cases, because the nurses will not be available 24/7, you might receive some training on how to administer medicine to your patient. This type of training will be given to you before you start your job, with the care provider. All right, before you start your job, if you will need to be giving your patients medicines, they will give you the training you need for the type of medicine you'll be giving them. All right, so we're not going to be talking much about medicine administration. We're just mentioning it in case your interviewer asked you that how will you administer medicine to your patients. Okay, make sure that you don't tell them that, oh, you will give your patient medicine. Okay, because it is not your role to give medicines. Okay, but in some cases where you are asked to give medicine, you will have been trained. So when they ask you, how will you give medicines to your patient? Your answer should be that you will not undertake a task that you have not been trained to do. That's the response for that kind of question during an interview. Okay? You will not undertake a task that you have not been trained to do. Okay, so the fifth topic is dementia. All right? Dementia. Now, dementia is a type of illness, okay, that is, you know, how will I put it now? Um, Dementia, all right? So dementia is a type of illness that is very common, okay? It's very common in the health sector in the UK, all right? There are different kinds of dementia, you know, you understand? You know, it's a type of illness that occur in the brain, okay? The type of illness that occurs in the brain, and people that suffer from it, they they are usually, you know, assumed to be people that are older, okay, but that is not to say that some people of younger age, you know, don't suffer it too. But most people that suffer dementia are usually the age of 65 and above, okay. Usually 65 and above are people that suffer dementia, you know, memory loss, basically. You know, dementia is memory loss, you know, and in, in 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 those ages of people that suffer it, you know, is you can classify dementia as the loss of ability to remember, ability to reason, you know, in such a way that it begins to affect their daily life. They cannot remember when to brush their teeth. They cannot remember when it's time to stand up and go to the toilet to, you know, to ease themselves. You know, the loss of cognitive functioning, basically. You know, and you know, people with dementia experience memory changes. They have difficulty in talking. They make poor judgment. Somebody say, what's the difference between poor judgment and unwise decision? Don't worry, we're coming to that. Okay, so uh, dementia is a disease that affects the brain, like I said, you know, and it affects people differently. Some people have dementia and their symptoms are not much. Some people have dementia and their symptoms are so much, you know, and it gets bad, you know, that they can't even remember their loved ones anymore, you know. So that's some people, dementia makes them to lack mental capacity, you know, and it gets bad, okay, you know. So there are different kinds of dementia. You know, there is dementia with Lewy bodies, there's vascular dementia, there's Alzheimer's disease, you know, there's so many, you know. So it's it's pathetic. But let's just focus on, you know, it's touching me because I know somebody, you know, that has dementia. So I really understand, you know, the challenges, you know, of taking care of a patient with dementia. So it's really, really emotional for me. Okay. So, so dementia basically is lacking loss of cognitive functioning. Because of this dementia, they are unable, to control their emotions. You know, sometimes they wonder they can forget their house. They go out and forget where, you know, they lose memory, they lose interest in a lot of things. You know, some of them, because of it, they have to you have to repeat things before they understand what you're saying. You know, and so on and so forth. You know, so if you're taking care of a patient that has dementia, you have to approach it in a very, very uh, compassionate way. You know, it's important that as a healthcare assistant, you you're able to uh, maintain their independence, their sense of well-being, you know, try to encourage them to be more to take control of their lives, you know, So sometimes you have to help them with personal hygiene because they forget to care for themselves, you know. You Those are part of the things. Usually, a lot of people with dementia are in mental health hospital because of some of them lack cognitive, ability, and to be able to do stuff. So you know, they will need you to help them and assist them in daily activities, you know, because of their dementia. All right. So as a healthcare assistant, you might sometimes need to take them around, take them on walks, you have to help them with their daily routine. You have to, sometimes some of them will have to be on one-on-one because they usually wonder about a lot and they will remember where they're supposed to return to, you know. And the safety of such people is important. Some of them will start cooking and they forget they are cooking, and the risk is high because it can result in fire. All right, so such people need continuous monitoring and supervision. Okay, so those are some of the challenges of some people suffering with dementia. All right, so the sixth topic is health, safety, and welfare. All right, health, safety, and welfare is the sixth topic we are talking about today. And for health, safety, and welfare, our safety as healthcare assistants is important, you know, because we have to be safe for us to be able to take care of others. All right. And we also have to be aware of some of the things that we are going to be working with, some hazards that are in our work environment as care assistant. Okay. When you are working, you be, for example, you are working with somebody with dementia now. You have to make sure you don't keep item, items that are not safe within their reach because they might see it as, for example, you put a cleaning substance within their reach and they look at it and they don't even know what it is and then they just drink it. So you have to put such items away. Okay, those are actions that you must take, to keep your patient safe. Okay, there are some items that we use in the course of our job as a healthcare assistant. For example, uh, they are used in the kitchen. For example, the fact that you use in the kitchen, doesn't mean all items in the kitchen are edible. Okay, you must keep cleaning agents away, such that it cannot come in contact with uh, items that are meant for cooking. Okay, And you must also understand the procedure for reporting incidents. All right, when there is an exposure or anything that poses risk, you have to report it to uh, the appropriate through the appropriate reporting channel. Okay, there's something called READOR. Okay, that is reporting of injuries, disease, and dangerous occurrences regulations. 1995. Okay. All right. So those are the things you must know while discharging your duty. And there is something we also call control of substances hazardous to health. Okay? Because every now and then a lot of workers are made ill by hazardous substances, you know, that they work with. Some of them because they inhale some of these chemicals, you know, and some of them maybe, if you use your bare hands now to touch things that you're not supposed to touch with your bare hands. So you have to be aware, you have to read the label of any substance you are going to be handling. Read the label and be sure that you are trained to handle such a substance before you attempt to use it. Okay? You have to understand that some substances are harmful, and they can be hazardous. So make sure you wear the proper protective uh, equipment when you are cleaning. If you have to clean, make sure you cover your nose and prevent unnecessary exposure to items that can damage your skin you know, or sensitive parts of your body. Okay, make sure you read the signs on the substances you are working with, whether cleaning items, whether washing, using the laundry, whatever item you are using, you have to make sure you read the signs on the container. Very, very important. All right. And in the event that accidentally anything happens that puts you at risk, you must report it, through the READOR. And that is, you must report to your manager and also report to READOR. All right. READOR is reporting of injuries, disease, and dangerous occurrences regulation. You report it through READOR. All right. So any injury that is occupational that happens while you're at work, maybe you are trying to lift something at work and you injure yourself, you must report to the occupational health, and make sure any injury that makes you off work for more than 7 days must be reported to Health and Safety Executive also. That's HSE. Okay? And it's important that you familiarize yourself with the local organization expectations in relation to incident reports. So if, for example, during the interview, the interviewer asks you, if you injure yourself in the course of your duty, what will you do? Just tell them you follow the organization policy, you follow the policy, of reporting of such incidents. You follow the policy laid down by the organization on such incidents in the workplace. All right. Thank you all for listening to the video and watching the video and listening to the audio. I hope you've been able to have some background knowledge on these 6 topics. So on your own, I will encourage you to check out the mental capacity, first aid, information governance, medicine administration, dementia, health, safety, and welfare. Do some personal study on these topics to have more understanding. Like I said earlier, this is just an introductory, for you to have an idea of some of the topics you need to know about, because you really can't tell where the questions will be coming from during your interview for the role of a healthcare assistant in the UK. So having the knowledge of these topics that you need to go and learn more about is key to give you confidence so that when you answer your questions during your interview, you can stand a chance of being shortlisted for the job.